Well, welcome everyone. Thank you so much for attending NAPSA's R2P webinar. I'm Esther Thorpe, the Administrative Coordinator with NAPSA, and I'll be moderating today's webinar. For those of you who are not aware, NAPSA, or the National Adult Protective Services Association, is a nonprofit membership organization that exists to provide training, advocacy, and networking opportunities for APS workers, allied professionals, victims of abuse, and anyone interested in preventing and raising awareness of elder and adult abuse. Please visit our website at www.napsa-now.org. The webinar today has been organized by NAPSA's Research to Practice Interest Group, and that's often referred to as R2P. So R2P is a network of researchers and practitioners across the country who all share an interest in advancing the field of APS and protective services. If you are interested in hearing more about the quarterly webinars or the work being done with ADDIE, which is the APS Administrative Data Initiative, we'd love to have you connect with us. And I'll put the link in the chat if you'd like to learn more about R2P. So before we get started, we will take questions at the end. So feel free to drop them in the Q&A. And after Jennifer is done, we'll get to them. All right, well, kick it off, Jen.
Thank you. That's great. Okay, I will start sharing my screen.
Looks good. I
There
can
we
see
go.
it.
How's that look? Good?
Yes.
Okay, perfect. All right, well, thanks everyone for coming today, and thank you so much for having me. Today, what I'm going to be talking about are reasons for withdrawal from older adult abuse support services. So my name is Dr. Jennifer Story. I am Canadian by background and training, but I currently work in the United Kingdom at a university called the University of Kent. So I'm sort of, for those of you interested, I'm like in the southeast of London, so of the country. The work I'm going to be talking to you about today, though, was data that was collected in Canada, and then I'm really excited to talk to you a bit about US data as well. So a little bit of background on me. I'm a forensic psychologist by background, and I conduct research and I engage in practice sort of back and forth. I'm doing quite a bit of work in the US at the moment. So I'm on an NIH funded project around older adult abuse or elder abuse. And then I'm also working with a couple of charities to look for funding from the Department of Justice to look a bit more into risk assessment and awareness of judges around older adult abuse. So here's what I'd like to cover with you today. So I want to talk briefly about kind of what we know about the reporting of older adult abuse, then a bit on like my progression on the topic. And for that, I'm going to talk about an illustrative case that kind of helped to get me thinking about it a bit more. Then I'm going to talk to you about that study that I described that we ran that specifically looked at withdrawal from a support service, which is going to answer or try to answer the questions: how many victims are withdrawing from services? Why are they withdrawing? And then what are the characteristics that might be able to actually predict victim withdrawal? And then at the end, what I'd like to do is have a bit of a discussion around what steps we can maybe take to reduce withdrawal. And also, I really want to hear from you about what research is needed in an adult protective services sample. So when I do get to the end of this, I'm hoping to talk for maybe around 40 minutes and then open it up for a wider discussion about the findings, about the extent to which you see this as a wider issue. And I'm going to be asking for your input and ideas around like next steps and where we should be going with research. So in terms of older adult abuse reporting, to date, most of the research has really focused on professionals reporting older adult abuse and sort of how often that happens. And we have less on victim reporting. What we do know, though, is, and you'll see from the broad statistics, somewhere between 11% and 70% of victims tell someone. But that's a broad gap, right, across the literature. But often that's not specifically a service, right, that they're reporting directly to. It's like family, friends, and informal sources. Victims face a range of different barriers. So things like fear around what will happen, shame about reporting potentially an abuser who's a family member, physical frailty and who might help them going forward, lots of relationships, and dependence on the perpetrator. We know that a couple things predict victim reporting compared to not reporting at all. So females are more likely to report. The younger old are more likely to report, so those between 60 and 80. Those with other with mental health problems, and then also those experiencing psychological abuse compared to sort of other forms. What we really don't know about yet, though, or we didn't until I did the study I'm going to walk you through, no one had really looked at withdrawal. So once a victim has actually reported, how many victims, if any, actually withdraw, and who is withdrawing and why are they withdrawing from services if this is occurring. So putting a quick pin in those questions for a second, I'm now going to just quickly describe sort of how I came into this concern and then raise a case example in a minute. So a lot of my research comes from me actually seeing a problem in real life that I've encountered through like my practice, through working with different organizations. So my background is in violence risk assessment and violence risk management. So it's really, I look a lot at identifying empirically supported risk factors for older adult abuse and then also other types of violence. And trying to determine risk level. So how do we decide which cases are high risk versus moderate versus low? And then with that information, how do we match risk factors to management strategies to actually try to reduce that risk, right? So if we see this risk in a case, like how do we actually intervene to mitigate what's occurring? I've done a lot of research on this, and then I've also done practice in this area. So for example, I developed a violence risk assessment tool called the Harm to Older Persons Evaluation. That's a risk assessment specifically for older adult abuse that looks at risk factors that have been identified in the research literature that tell us a perpetrator or an accused is more at risk of doing harm again, and also that a victim is more at risk of being harmed again. I do quite a bit of training on this and then also case consultation. So I sit on some high risk tables when we see these cases coming forward. And through a lot of that work, sort of in practice and talking to different professionals and seeing a lot of cases, I noticed withdrawal as like a practice hurdle that people were running into over and over again. So what do I mean by withdrawal? What I mean is that there was contact with the system and then the victim pulled back and said, I don't want this contact anymore. So it's not that that person was unaware that there was abuse. It's not that no one reached out to help or offered assistance. These are cases where there is abuse, there is a risk, right, that's been identified, but the victim is saying, no, thank you. I don't want services, you know, or it's something less polite than that I've seen as well. So I now just quickly want to go over a case study illustrating when I've seen this hurdle in practice and then what it can potentially look like for practice. So Esther, this is the cue to just pause the recording for a little bit.
Okay.
Recognizing, and some of you will probably have seen some similar scenario to this one. Starting to think, like it started me thinking about how do we balance providing social support, individual autonomy, when we throw in if someone has cognitive capacity or not, how do we balance this with refusal of services? And in this particular case where they'd kind of just come to a standstill about how to intervene, and we're almost waiting for something to happen before they could intervene. So this also wasn't the first time I'd seen withdrawal, looking at going through cases. So I had a hunch that, you know, this Jack and Archie situation was more common and therefore an issue for others as well. Plus, there was very limited research literature. Couldn't find an answer to how many people withdraw and how common this is and what we're supposed to do about it. So what I did in this study was I took the first few exploratory steps to figuring out what we're looking at here. So in this study, I tried to identify how often victims actually withdraw from older adult abuse services, because we didn't know that. What reasons are they giving for withdrawing? And then is there anything that we know that can predict their withdrawal? Because I think if we can identify who's most likely to withdraw from a service, then we can potentially stop it, right? And retain them in the service and try to continue helping. So, like I said, the study was a little bit exploratory, mainly because I'd collected the data for other particular reasons, and then this issue came up, so I wanted to investigate it as well. But you'll also see we had 151 cases in this sample, which isn't bad, but it would be really excellent to look at this in a bigger sample. And so I will plead with you guys later about APS samples related to this. So the data came from a service that's held under Catholic Social Services in Canada, called the Elder Abuse Resources Supports Team, or EARS for short. So it's a not-for-profit service. It's sort of Canada's first and longest running social work intervention program for older adult abuse. Essentially how this works in Canada, each province, so similar to each state, has a different way of managing these types of issues. And I think that's similar to APS, right? It works slightly different in different states. And so that's similar here. This particular service works out of Edmonton in Alberta, Canada. So they service that area. The way that it works is they get reports that come in. So it could be from the victim, it could be from a concerned member of the public or a professional. At the point that it comes in, they do a comprehensive intake of the file. And for that, I worked with them in the beginning, and they've implemented a lot of the HOPE in there so that they're capturing a lot of these risk factors right from the outset of the case coming in. So even when there's early withdrawal of a victim, we still had a lot of information on what was going on for that person because of their quite comprehensive intake. So the intake comes in, the case is either referred to another service if that's appropriate, or it's worked by a social worker who may also engage with police, engage with a nurse, whoever they think, engage with housing, whoever they think is most appropriate to assist in that case, they will pull in, and then they will sort of work it together and alongside. Their goals are increasing victim safety and ending abuse, and they focus quite a lot on victim autonomy. So working towards goals that are set by the victim. The other thing of note, which I think maybe differs between Canada and the US, is Canada only has mandatory reporting of older adult abuse when the potential victim is within a facility, so like a care home, long-term care, retirement home, whatever the term. And the regulations exist sort of by province. And where outside of that, where a victim has capacity, they are allowed to refuse help, refuse referral, right? So it needs to be like within a care facility, or there needs to be some kind of capacity concerns there. So I mentioned that we used this comprehensive intake form to get a lot of the data. What we also had were case notes, they called them contact notes. But essentially, every single contact with the victim and other individuals in the case was consistently documented. So I had all the information that they'd sort of collected on the case initially, and then all of their progress moving forward right up until the end of that case. So that included, characteristics of the victim, characteristics of the accused, and it also included if they withdrew, and then what information and reasons were given around that withdrawal. So in the end, I looked at 151 cases. I only included cases where there was evidence that definitely that victim withdrew. So if it wasn't clear that the victim knew there'd been a report made, like let's say it was made by a professional, but there was no sort of engagement and it wasn't clear if the victim was involved, that was excluded. Or if the victim passed away during the time they were with the service, that was also excluded because they didn't withdraw. So this slide is just giving you information on the sample. The main thing to think or to notice from this is it pretty much looks like what we see in the research literature. And the research literature is just dominated by the US. So this is probably, the sample is probably very much in line in terms of like age, gender, abuse type as to what you're seeing in the United States, because we compared sort of ours to the most of the literature, which comes out of the US. So victims were about 76 on average, with perpetrators being around 48, majority female victims, majority perpetrators were male. In terms of abuse type, vast majority is what we call poly-victimization. So basically means multiple types of abuse were occurring in the case. Adult children were the most common perpetrators in the sample, followed by spouses, other relatives, and then other individuals who were non-relatives. So in terms of answering the questions, how many victims actually withdraw from services? So what I did was I separated the cases into cases that were resolved versus cases that were withdrawn. So resolved cases were those where the case came to a natural end with abuse having sort of ended as identified by the service and identified by the victim. So they were resolved in a way that everyone was sort of happy with, or there was an appropriate referral to another system because ears could no longer handle it, but that only happened in a small number of cases. Withdrawal was when the victim did not want to engage with the system anymore. They withdrew during the intervention and said, you know, don't call me anymore, or they refused to speak any further. So what we found was that a third of the victims were withdrawing. And for those of you who are familiar with reporting rates of older adult abuse, they're tiny, right? Like we think maybe 4%, maybe slightly higher, are actually reporting to a service. And then the concern here is we're losing a third of them once they get to the service, right? So they're withdrawing. The other thing I was interested in looking at was how long were these cases sitting with the service? So how long were they being worked by ears? And I thought most likely that the cases that were resolved would have been with the service for longer, and the cases that withdrew would have been quite quick. So they would have withdrawn quickly from the service. What I actually found was that there was no difference in length between the withdrawal group and the case resolution group. So with even some of the withdrawal groups staying with the service for 672 days was the max before actually withdrawing. So I thought this was really interesting because I definitely thought there would be a difference here. And as we'll talk about in a couple of minutes, I think this is quite concerning because it means that these individuals are sitting with the service for a very long time and utilizing resources for a very long time before withdrawing and not having a good resolution to the case. Reasons for withdrawal. So why did victims say that they were pulling out from the service? Looking through their descriptions, I found 7 reasons that victims were backing out. The most common was that they said, I don't want support anymore. They said that either because they denied the abuse, so I don't want support anymore because there's no abuse occurring. They either gave no reason, they just said, I don't want this, don't call me. Or they sort of, yes, there's abuse occurring, but I still don't want support. So that was kind of the biggest group. The second reason that they gave was that they didn't want to take the steps suggested by the service. So for example, one victim said, what you're asking me to do is just too hard. So basically, I don't want my son to move out of the house. That's too difficult for me. I can't do that. So like, I'm withdrawing from the service. I don't want to engage with this anymore because I can't do what you're asking me to do. The third reason was that the victim wanted to deal with the situation within the family. And then the rest of the reasons each came up only one time across the cases. So in one case, the victim was unable to proceed because of their health. One said they were too afraid to keep going. One claimed that the abuse had ended, but that wasn't verified in any way. I don't think it was really believed either. And then the last single victim said that they were taking other steps outside of service involvement that they thought were going to work, basically. And in one case, I couldn't find a reason, so it was unknown why they withdrew. So that gives you reasons for withdrawal. And then the final question that I wanted to look at was, is anything predicting withdrawal? Can we figure out, from the get-go, based on characteristics, who's going to drop out on us, who's going to withdraw? So the variables that I looked at were either relevant to how we classify cases, or risk level. So items that we know are related to increased risk of abuse, and that are changeable, things that we can actually kind of improve in the future. So the risk assessment tool HOPE really focuses on those, because if I told you victims of a particular age are going to withdraw more than others, or a particular gender are going to withdraw more than others, there's not much we can necessarily do we can't change someone's age and gender, right? So these are variables that we can sort of try to focus in on. They tell something about risk, and they're changeable. The way that we did this was by putting them into a regression model. So I won't go into great detail about that, but I can later if anyone's interested. But it essentially shows you which of these variables predicts withdrawal in the future. So we looked at the type of abuse, the victim-perpetrator relationship, and then a series of risk factors. So whether or not the victim had a mental health condition or any addiction, whether the victim was self-neglecting, whether the victim was dependent on the perpetrator or the accused person, if the victim was isolated, if the victim was living with the perpetrator, and then also if the victim held any attitudes that could be problematic, like they were minimizing the abuse, or they were completely denying the abuse. And just to note, I coded denial of abuse from their entire file, not just their reason for withdrawal. So I looked through to see whether that was like a pattern or if it had come up anywhere in their file. So what I ended up finding out, and I've given you the frequencies I've already shown the abuse type and the relationship frequencies on a previous slide. So this just shows you how often these risk factors were coming up in the cases, and they were pretty common. But of those, the only ones that were predictive of a victim withdrawing were self-neglect. So if they were engaging in self-neglect, they were more likely to withdraw from the service, and if they had problematic attitudes. So for instance, denying the abuse, minimizing the abuse. What was really interesting at this level was that denial was very much in line with the reason that they gave, right? And the number of people. So about 26 people gave that reason as why they left. But then 37 had it somewhere else in their file, and therefore it predicted them actually withdrawing from the system. As a last measure, what I did was I put self-neglect and denial of abuse into the same model, regression model, to see how much of the withdrawal they were actually predicting. So what happened when I did that was self-neglect was no longer significant. So it actually fell out of the model, and what it said was denial of abuse seems to be the most important thing. So anyone who denied the abuse was 3 times more likely to withdraw from the service. Okay, so what does this all mean? Kind of pulling some of this together. What we know now, that we didn't know before, is that withdrawal is happening in about 1 in 3 cases. The predictor of withdrawal is actually quite in line with the reason that victims are vocalizing. They're saying, I don't think there's any abuse here. And then that's also showing up from coding all of the information in their case. I think, in addition, this is very worth considering as a problem, given how big it is. This has a huge cost to the victims, right? These are individuals who there was abuse. Despite the denial, it had been confirmed. There were multiple sort of agencies involved. They're withdrawing. We know from practice that they're not going to have great outcomes as a result. In addition, if we want to just look at this purely from a money perspective to try to alert someone to the problem, this is actually a costly problem. So 1 in 3 cases are coming into a service. Some of them are staying there for over 2 years, and then they're withdrawing without a positive outcome. So that's not great, right? That means a lot of service dollars and time is going out without the positive case resolution that we want. So this is an issue that we should be dealing with from like a human perspective, and then also kind of this financial perspective. So how could this sort of help Jack and others when we think about understanding these results? So Jack never actually voiced that he was being neglected or abused. He didn't voice a problem, but equally, no one asked what was going on. No one really stepped in. So there were some offers, but there wasn't like a push to get in. There were no direct conversations with Jack. If there were, they were very short. Help was offered, it was started, and then he would withdraw. But there wasn't really anyone who stepped in. Now, when we brought this case to the case conference, that was heavily challenged by sort of everyone in the room. They were very concerned about the fact that, you know, someone should have stepped in, like, why wasn't action taken? Everyone could see this is going to end in disaster. Like, we need to be pushing more in these cases. But the question is, how do we actually promote sustained engagement, right? We only just sort of identified this as a problem. What can we be doing to help? So some of the implications, I think, of this are the results that we found are very much in line with Anderson's behavior model of health service use. So what this model says is that denial relates to a need for service. So if you are denying abuse, you see your service need as low, right? Because you perhaps don't think abuse is occurring. So like, why would you need a service? And what this model says is that the need for service is predictive of actually using that service, which is sort of just common sense. Some of these models are just common sense, but that makes sense. But the positive part of this is that they identified that this can be modified with education. So this is something that we can actually try to fix in terms of how someone sees their need for a service. In particular, victims tend to seek help when they perceive danger. And barriers for victims are when they lack awareness about abuse, or they think the abuse wasn't serious enough. This wasn't that bad. I shouldn't waste anyone's time. I don't know if I should reach out to services. So what this tells us, the results in line with this model, is that we need to change the perception that victims have, and we need to change their awareness of what abuse is, of what services, of what service need they have going forward. Some ways that we could think about doing this are screening for denial, potentially at intake, so when you first see someone, and then maybe at other time points to see how they're viewing. Engaging in motivational interviewing. So there was a study by McNeil and al. In 2023 where it showed that they helped older adults to navigate their ambivalence and their motivations for change by engaging in motivational interviewing. Another thing that we could potentially do is share assessments with them, share concerns with them about risk. We can't assume that victims know what their risk is. We can't assume that they know what risk factors are for older adult abuse. Can we share some of this information with them so that they sort of understand that abuse is serious enough, right? That their risk is serious enough that they do have a need for service. And then finally, leveraging your relationship with clients to set goals and then also leave the door open if they withdraw. So two things there. In terms of setting goals, one of the reasons that victims said they withdrew was because they didn't want to do what the service wanted them to do. So their decision was to sort of back out. Setting goals together could potentially help to avoid that, right? So that individuals are on the same path in terms of what the goals are, and we know what that person is willing or not willing to do. We can always try to encourage, right? But it would be nice not to completely lose someone from the service. And then second, leaving the door open. So 1 in 3 are withdrawing. The likelihood is, even if you do a fantastic job, someone's going to withdraw. Like this can happen to you. So if you can use your relationship, continue to have a positive relationship, ask them why. And if you can't change the reason, leave the door open for them to return without judgment, right? So if this is what they're going to do, just make sure that they feel comfortable coming back, that they remember you and that they know how to, come back and contact you again to get help. So what I'd like to do now is actually hear from you. So these are some ideas, I think, of what we could talk about or what might be helpful to sort of discuss, but please raise whatever you'd like here. My goal is really to hear your ideas and facilitate some future research and support in this area. So first I was thinking, I'd like to hear, is this also an issue in APS, right? I've told you something about Canada. Is this an issue in APS? I suspect that it is because I've been invited to talk to you today, but also because I've been approached by a researcher who actually does research on APS data, and he's really keen to run this study somehow in the States as well. And so we're interested in your ideas about what we should be looking at within your data, right? What your data might look at, what should we focus on? So that covers sort of what research we could be doing, what would help you, what do you think is important? I'd be interested in knowing if, or maybe you're already doing this, are you recording reasons for withdrawal so that we could take a look at those? And then also maybe we can think a bit about, is denial of abuse always the same? Is it actually that they're denying abuse, or are they maybe masking something else when victims are saying this to us? So with that, Esther, if we could open
Yeah.
up, or if there's already questions in the chat, I'm happy to go either way.
Yeah, everyone is allowed to talk. So if you want to unmute yourself to start the discussion, please feel free to do that. Someone did ask in the comments if these slides will be available.
Yeah.
Are you allowed to share these? Okay.
Yeah, I can do that. I can send you, I'll take out the case, but other than that, yeah, absolutely.
Okay. Perfect. Thank you. Yeah. Any questions, guys, or discussions?
I'm trying to raise my hand. So here in Ohio, we do see where people will withdraw based on allegations. Typically, I see it higher with the physical abuse allegations dealing with a
Okay.
family member.
Mm.
Sometimes the exploitation with the family member. And I've noticed, and I don't know if this is something that you've seen, but typically when I'm having a person that has um, multiple children, they are more adamant to withdraw if it deals with their male son versus their daughters when it's dealing with physical abuse or exploitation.
Oh.
So for some reason, there's like a protecting there that they feel towards the male perpetrators versus the female perpetrators. So that's where I see more withdrawal at. I don't see them wanting to press charges or do prosecutors referrals or anything in regards to their male perpetrators. But with the daughters, I see hey, no, my daughter's doing me wrong emotionally,
Ah,
physically, things like that. So I do see the withdrawal here in Ohio, but again, higher with the male perpetrators. Like,
interesting. So, the researcher that I'm going to work with has data from Ohio. So that would be really interesting. And that's a great idea to look at because it didn't even occur to me that there would be a difference in terms of perpetrator gender. Can I ask, have you noticed whether or not those male perpetrators, if they have more like dependency, mental health, substance abuse problems, and so the older adult like feels like they need to give them extra latitude? Do you know what I mean?
yes, I actually do kind of coincide those together. Once I've met with the perpetrator, because they're typically in the home, they do have some type of mental illness, or
Yep,
there is some type of addiction present in the home.
yep,
I've encountered it where, especially for exploitation, they may
yeah,
not live in the residence, but the person is on a fixed income, but they feel like they have to give them this money or continue helping them, supporting them in life. And
yep,
they don't see it the same as like I had a case recently where the power of attorney was the daughter, and she's trying to protect because the brother actually comes and gets the mother's card and does all this stuff, and she was very upset with her daughter for basically protecting her. And she was like, hey, he's my son, I can help him. So,
yeah.
sort of like
That's
that. And he definitely had addiction issues. So
yeah. Okay.
And
That's
Shawnee's,
super. Yes.
oh, sorry, just real quick follow up there.
Yeah.
Shawnee's, hi, Jen, really great
Hey.
presentation.
Thank
Um,
you.
Shawnee's, would you say that's true of male clients and victims as well as female clients? That gender
yes,
difference?
I have seen it in both. For whatever reason, they tend to want to protect the male perpetrators versus the female perpetrators. And I don't know why there is a difference, but I mean, I'll say probably 6 out of my 10 cases, they do not want to go through with pursuing any type of legal action. Their accounts could be completely depleted. I can physically see bruising on them, and they'll be like, "No, I don't want to." No.
Wow. So, that's super helpful because we could take a look at gender differences within the perpetrators and then potentially also the level of like the number of risk factors that they would have as well, because that's really interesting. Um, if we run into questions about Ohio, could we reach out to you? Is that okay?
Yes, ma'am.
Yeah? Um,
Yeah, definitely. I can
yeah, if
send
you
my
could send.
email over.
Please, yeah, that would be super helpful because it's easier, I think, to look at data if we like you saying that that makes total sense. I completely see where you're coming from, but like I hadn't thought of that as something to vary. So that's really helpful. Thank you.
Okay. Thank you.
Hi, this is Heidi Turner Stone. I'm also from Ohio, and I'm from the state office for APS. And that is something that we are very interested in, along with recidivism, because we're finding that a lot of folks who back out of services end up back with us. And sometimes
Yeah.
it's more than one other time. It could come back 2 or 3 times, and each time they want to withdraw, or
Yeah.
they are just, they're still not satisfied, so they just kind of walk away. One of the things we don't keep a record of is the reasons for the withdrawal. Like, say we wanted to run the numbers, and we have a category called client refuse services, so we can measure, we can say how many clients refuse services at any point, during the case. That's the reason for the case closure.
Got it.
But We don't have an area to really, that's like a drop down or something to capture why they are refusing services. And so I think it might be, just listening to this, it might be good if states are working on updating their data systems to start capturing that. I know that's something that I'm going to add to our list of enhancements to our data system, because just listening to you talk about how to reach them once they've left or when they're thinking about leaving. If we know why, that might be a little bit more helpful. And I mean, some of the things that she just mentioned, there's not much we can do with that. But it also gives us an idea if they're tired, they've been on a waiting list for a long time for a service or something like that, and they're tired of waiting. Well, if we know that, then we can start looking at gaps in services and things of that nature as well. So thank you, Ohio, for speaking up.
Yeah, thanks for that, Heidi. That's really helpful. Is that a difficult process to change?
Well, we look at enhancing the data system every year, and we are coming to the close of current updates. So it's something I'd have to add to the list for next time.
Yeah. Okay. That's super helpful, especially if we end up getting Ohio data. Heidi, same thing. Would it be possible for us to reach out to you and ask questions if we end up getting access?
Certainly, and to be honest, the state level, if you want to look at state data, you would have to go through my office anyway. A county can give you the data that they have, and we are state supervised and county administered. So the counties are on the front lines doing the hard work, so they can talk to you about, anecdotally and present case information. Because I never knew what she mentioned about, usually it's the men who get the mercy from the abuse.
Yeah,
that's very interesting to know. And so if you need state aggregate data, though, you'd have to come through the Ohio Department of Job and Family Services.
Okay. Yeah, the person that I'm potentially working with on this has done it in the past, so I think they'll hopefully.
Are you working with Kenny Steinman?
Yeah.
Yep. He has a data request in right now. So counties, get ready. She's going to come talk to you.
Heidi, say yes.
And Heidi, even though the data aren't available in a specific field, assumably they could be gleaned from the case notes and probably often recorded in case notes, right?
And that, that would require reading case notes. And that is not information that we give out. We can give out numbers, but to read case notes, we would have to do the reading, or like the young lady who was on there, say you asked her county, she would have to do the readings and they'd have to do some computations because confidentiality does not allow us to give out information that specific.
Yeah, I mean, for me, it was difficult. I worked with one of the social workers at the organization I looked at, and she redacted everything so that I could see it. But it was painstaking for sure. But that's super helpful. Thank you.
Kay, you have a question?
I have a question. Yeah, are you able to hear me?
Yes.
Okay, perfect. I have a headset. I was kind of piggybacking also off of Ohio. They talked about some of the trends they're noticing in reporting when it comes to gender. But what it raised for me was a lot of questions around trends when it comes to culture. And I say that because when you look at from a cultural lens, you're thinking about, of course, family structure. You're thinking about, I know here in Kentucky, we have many diverse communities. And so we're working with pockets in which there is, in general, a distrust of government agencies. There are families and populations that have a history of oppression from government. And even in recent days, the climate here. And throughout the nation. And so I'm very curious about what role gender plays. Another thing that we've done is there's been a lot of centering around language access for all across the state and understanding what tools are available for deeper and meaningful language access. And so when we're thinking about reporting, again, the lack of common language and how difficult it is for someone to communicate their needs and understand around that translation. So I'm curious, with your study and research, are there reports on tailored interventions for working with targeted populations? So understanding the trends around culture, that with a culture lens and what factor that plays, but then some key outcomes and strategies for tailored interventions. Does that make sense?
Yeah. Excellent question. And I think something, assuming culture, ethnicity, that kind of thing, if that's in the big group of data, I think that would be an excellent thing to look at within APS data too. I think, so there is one researcher that I've worked with in Canada who's looking, she does like ethnocultural older adult abuse work. Her name is Rose Judy. If you want to send me an email, I can put you in touch with her. So she's actually put together like a toolkit. So she did a lot of outreach with like a whole bunch of different groups of different backgrounds to try to understand what they thought abuse was, how they wanted to engage with the system, how they wanted to engage with each other, like what kind of supports they wanted. And so she's put a lot of that information together into a toolkit. So I could facilitate you getting in touch with her if that would help.
Yeah, absolutely. That would be amazing.
Okay, perfect. I'll put my email, my email's on the slides, but I'll also just put it in the chat now as well, so that please feel free to email me for extra resources or with ideas that you have that come up later. There we go.
Can I ask a question about the education aspect around the denial of abuse? Hi, this is Kat. You had mentioned that one way that well, I'm associating this with APS, could maybe get around that withdrawal because of denial of abuse is to provide education around it. Did you all have any like concrete tips on providing that education, and really specifically when you only see that person one time and maybe don't have a long-term case management with them, where you are very concerned about high risk and you want to provide that education, but not coming in super hot?
That's a really good question, because you don't want to frighten someone, right? It's a really good question. I'm trying to think now, and I'll lean on Zach if you have anything that you can think of that's like guidance for giving education in these contexts. That would be helpful.
Not off the top of my head, just because there's such a wide range of practice.
I know.
But I'll ponder it a bit more.
Yeah, same. Kat, if you wanted to send me an email, I'll keep thinking about it and see if I can identify like some concrete, because I have to say, when I looked at these files, like there was a huge range of practice, and I could, like in some cases, you could feel that the practice was related to, you know, some of them were doing great education and sort of outreach and trying to keep people involved, and in other contexts it wasn't working so well. So like Zach said, there's a huge range of practice, and I don't know of anything concrete, but I will think about it. If you send me an email, I'll try to find something for you.
Thank you, and thank you, Zach, as well.
All right. Well, thank you so much, Jennifer. This was a really great presentation. Just a reminder, we will be posting the recording and the slides on the NAPSA website. Thank you all for joining us today, and I hope you have a great rest of your week. Bye.